Better Health Chiropractic is a family practice who services the healthcare needs of the entire family. The doctors utilize several of the most advanced techniques and tailor individual programs of care to help you achieve optimum health. Joining us today is Dr. Scott Beavers on what peripheral neuropathy is and how it can be treated. Welcome, Dr. Beavers.
Great. Good morning.
Good morning. Happy to have you. And so, doctor, tell us, what is peripheral neuropathy?
Well, peripheral neuropathy, the easiest way to understand that is it's a form of nerve damage. It primarily affects the feet, toes, and legs. The second most common site would be into the arms and to the hands.
Okay, and how common is this medical condition?
Well, this is a condition that is increasing in its number of patients and people suffering. We're up to about, some estimates are about 8% of the American public suffers with a form of peripheral neuropathy. And that's close to like 40 million Americans.
Wow. Okay, so what are the most common symptoms?
Well, that would include numbness, tingling, pins and needles, burning, cramping. Many of our patients in the latter stages will experience balance problems or even falling.
And what causes peripheral neuropathy?
Oh, that's a great question. Many times we can determine the cause, and that would be things like diabetes would be the most common. That affects somewhere between 30 to about 50% of people with peripheral neuropathy are from diabetes. But there are many other conditions like thyroid disease, liver disease, autoimmune problems, alcoholism, different types of infections, and even traumas that can cause or create peripheral neuropathy.
Oh, wow. And what is the most common treatment that patients are offered?
Well, typically, the frontline treatment provided for most patients by their primary healthcare providers are medications for pain. And sometimes those are helpful, and sometimes those are not to help the patient.
And what is different in your approach to help people with this medical condition?
Well, a lot of the things that we bring to help patients come out of the sports world. My background is in sports science and sports medicine, and a number of the types of treatments and techniques that are used there also can be incorporated in to help our patients. And so there's some things like, diet, nutrition, exercise, but there's some more innovative things like laser therapies, light therapies, some sophisticated type of electrotherapies, and even some cutting edge techniques where we're using focused acoustic sound waves to stimulate healing and help patients many times when they couldn't be helped in other ways.
And when going to Better Health Chiropractic, what results can patients expect?
Well, our goal for our patients is pain relief. We want them to feel better. We want them to, many times they need to start sleeping better. They want to have improved balance. We want to help them reduce the risks of falls. And, we want to help them, maybe regain an active lifestyle, regain some of the
Patients
they've had to give up on because of the disease that they're suffering with.
And Dr. Beavers, who should come in to see you?
Well, the patients who are struggling, that maybe have not found help, if they've been suffering with numbness, tingling, burning, cramping, balance problems or falls, maybe their condition has been progressing even in spite of their treatment. Those patients should contact us. They should reach out and see if there's a different type of treatment that can be provided to help them.
And with peripheral neuropathy, why is it important to take action now rather than waiting?
Well, unfortunately, many forms of peripheral neuropathy are what they call progressive, and that means they get worse. And so a number of our patients will explain to us that this problem's been going on, and it's getting worse and worse. And there is a point where there's so much damage that they can no longer be helped. And so early detection and early treatment is key for these people.
And Dr. Beavers, what has been the response from your patients when getting treated for peripheral neuropathy at your clinic?
I would say of the patients that we accept for treatment, over 90% of our patients improve between 50 and 80% with their symptomatology.
Oh, wow. That's great to hear. Well, thank you so much, Dr. Scott Beavers, for joining us. And for more information from Better Health Chiropractic, visit bhchiro.com.